In this video, we're going to show you now some remediation steps to take place when you're doing a skill evaluation or a classroom type of training. We want to help you to help the student so that the student is able to learn best without putting the student down. And that's what we're going to cover here today. So first of all, Roy and I are both doing this as instructors that are certified in this and have been doing this for many years. And we are going to try to bring out some of the common mistakes that people do on a regular basis. So first of all, I'll be a skill evaluator and Roy will be a student who's come in, and I'm the skill evaluator who's not prepared. That's what we're going to play out in this situation. So or I'm in a hurry or in a rush. So let's see how this goes. Okay, Roy, I see that you're here for the skill evaluation. Hey, look, I've got some other people coming here in 10 minutes, so we got to get this done now. So go ahead and show me what you got.
Okay, well, I haven't done this in a long time, so I'm a little bit rusty.
Just go ahead and do CPR for me for a minute, okay? Go ahead.
Just regular CPR?
Yeah, go ahead.
Okay.
Yep, hurry up.
Just get right into the compressions?
Well, no, we need to start with the stuff at the beginning, but let's just get this thing done, because I'm telling you, I got to hurry.
Okay, is the scene safe?
Yes, the scene is safe.
Okay, my gloves are on.
Yep.
My shield's available.
Got it.
Okay, I think...
Come on.
I think I tap and shout first.
Yeah, go ahead. Go ahead.
Are you okay? Are you all right?
That's fine. That's fine. He's not good. Go ahead. Come on.
Does he respond?
No, there's no response at all.
He didn't respond?
Nope.
And
Next thing, come on. We got to move it right along here.
Don't I start with 2 breaths?
No.
No, that's right.
That was way old.
No, I remember. Okay, so it goes right into compressions.
No, listen, you're a healthcare provider. You need to know this stuff. Come on.
But I mean, it's been a long time. I thought you were supposed to help me practice
Listen,
first.
well, okay, let's just move on. Let's just keep moving. Okay, so you're going to call your code, 911, whatever. Check your pulse. Check your pulse.
Is the code called then?
Yeah, it's done.
Okay.
Check your pulse.
You're making me kind of nervous, being in such a hurry.
This is okay. Let's just move. Come on. Check your pulse.
Okay.
Okay.
Checking for a pulse.
There's no pulse.
Okay, there's no pulse. So you're just making me nervous. Speeding me up like this is just really
Let's just do some compressions at least. Just get going. Come on. I've got to hurry up. I've got to make sure you know what you're doing here.
Okay, how many do I got to do?
Yeah, okay. That's
Do I do
enough.
it fast?
Good enough. That's good. Okay, and now the breaths. Hurry up. Okay, you're not getting the breaths in. Come on. You're supposed to have done this stuff. What is wrong with you?
You know what? This is obviously not working, so why don't we just quit? Okay?
All right, we're out of here. Now, obviously, this was overacted, but you will see that the skill evaluator was not prepared. I wasn't ready in this situation, and you see how that made you feel.
Yeah.
Frustrated. Extremely frustrated. I wasn't helping the student at all, and that's not what we want to see in a skill evaluator or instructor. What we want to make sure that you do is you help the student through this. You see the student came in, and the student was ready and willing to learn. I just wasn't ready to help teach that student, and that's a major problem. As a skill evaluator or instructor, you need to be prepared to help the student practice through these skills first. That's part of the skill evaluation, practice and evaluation. Roy, what's some other things you might add to that to be prepared as an instructor or skill evaluator?
Well, you know, in my experience as well, it doesn't matter what the tenure of the professional. If you haven't done it in 2 years, even if you ace the test, when it comes to the practical, they could have a lot of nervousness, you know, especially if they're old school and they've gone through other instructors like this that have put a lot of pressure on them. This testing anxiety can sometimes make them make mistakes that they ordinarily wouldn't if they felt relaxed and felt confident with their instructor.
Exactly. Well, let's go on now to move on to the idea of some of the skills and how to actually help that student. So when you notice them doing certain things, these are just some common things that we see quite frequently. Let's start off with compressions. So,
yeah, sure.
Roy, why don't you go ahead and show me some compressions here a little bit, and maybe not exactly correct there.
Okay, so some of the more common wrongful compressions, I'm going to kind of model that a little bit, maybe too low.
Okay, so as we see him pressing here, he's on the stomach actually, and we want to see that. So I would say, Roy, you know what? There's a better place to put your hands. What we want to try to do is be directly in the center of the chest, above the area where the ribs come together. That would be considered the lower third of the sternum. Let's put your hands right there, or we say that's in the center of the chest. Let's try that. That's perfect. That's the correct location. Okay. Now let's try those compressions. Excellent. Great job. So you see how that was done? That was the idea of encouraging that student, showing that student what to do, not just saying, just put them there, just get it there. That doesn't help the student just to bark commands at them. You want to actually show the student, and that's going to be the most helpful thing to have that student actually remember this. Let's try a couple other problems with compressions.
Yeah, maybe a technique issue.
So as you see what's happening here, obviously he's over-exaggerating, but the arms are all over the place. What we want to do is, Roy, we want to lock those elbows nice and straight. Good. Good. And let your body weight do the work of the compression. So you're pivoting at the hips to let the body weight go down deep into the chest. We're going 2 to 2.4 inches deep. Excellent job. And again, the arms is a big problem. A lot of people want to jab or they want to jerk, and that doesn't produce a very effective compression. We want to make sure that we get smooth, deep compressions down into the chest. Let's try another problem.
Yeah, maybe another one might be the hopping all the way up off the chest.
As we see this here, again, this is not effective. It's not producing that heart to, or getting that heart to squish to produce that blood flow that we want to accomplish. So the way to correct that is we say, well, Roy, I'd like you to take your hands, let's put your hands on the chest. When you push down, go all the way down. When you come up, let the chest fully recoil, but don't pull your hands out of contact with the chest. That's the idea. Excellent, great. So we're definitely pushing down all the way, coming up all the way, but not coming off the chest. And that's another thing to correct there as well. Good. Now that we've covered the common issues with chest compressions, let's move on to the breathing. Okay, Roy, go ahead and let's try a couple of breaths, but let's try one of the most common mistakes that people do right here. Do you see what's happening? The airway is not open. The chest is not rising and falling. The lungs are not getting air into them. The simple fix for this is simply to remember to remind the student to open that airway fully with a head tilt chin lift, just like that. And you'll see that this clearly opens up the airway, allowing the air to go into the lungs and the chest to rise and fall. It's one of the biggest problems. The other thing is the person doesn't pinch the nose. And a real person, on the mannequin, obviously, mannequin's nose is pretty sealed. But on a real person, if you don't pinch the nose, the air will come out the nose. The other thing is too forceful of a breath. You want to try that? Oh boy. As you see, if you did this on a real person, that would be a problem. The air has to go somewhere, and it's probably going to go into the stomach. And if it goes in the stomach, they will probably vomit at that point. We don't want that. That's going to cause more complications. So we don't want to see forceful breaths or too much of a breath or too long. The other problem is not enough breath. So they go down, but they just kind of go like, eek, just like that. Well, they're not making the chest rise at all. And again, that's not going to help the person either. We need to actually get air into the lungs and make that chest rise and fall. Any other things you would add to that, Roy?
You know, I think that's really it. On these mannequins, depending on the type of mannequin you're using, it is common for the lungs to sometimes have a twist in them, or in the airway there's something binding it. So it can be very common when you're under pressure, or maybe the student is putting pressure on you as the skill evaluator to hurry this thing up. And they go to do a rescue breath. You can see that they're doing the technique correctly, but the chest is not rising and falling. Make sure that your equipment is operating correctly. I guess in a worst case scenario, you have complete mannequin failure. You could explain to them manually, you should see chest rise and fall with each successful breath. But in most cases, just troubleshoot your mannequin. I bet it's probably something simple that you can fix, and then you will be able to see that chest rise and fall and create that confidence level in your student.